Can a patient refuse electroconvulsive therapy, ECT? Have you ever wondered if someone can say no to a treatment that might help them? This question becomes especially important when we talk about electroconvulsive therapy, or ECT, for patients with schizophrenia. ECT is often used for severe psychiatric conditions, including schizophrenia, when other treatments have not worked. But can a patient refuse this treatment? The answer is not straightforward. Generally, patients with schizophrenia have the right to refuse ECT, but this right depends on their ability to give informed consent. Informed consent means that a patient understands what the treatment involves, including its risks and benefits, as well as what might happen if they refuse it. However, schizophrenia can impact a person's insight into their illness. This means that some patients may not fully grasp the situation, which complicates their ability to make informed decisions. If a patient is found to lack this capacity, healthcare providers may be allowed to administer ECT without the patient's consent. This is often done to prevent harm and ensure the patient receives necessary care. Legal rights play a big role here. Patients have the right to be informed about their treatment options and can refuse treatments like ECT. They also have the right to challenge any decisions made about involuntary treatment. Laws vary by location, but many jurisdictions requiring a careful balance between respecting a patient's autonomy and ensuring their safety. Courts have ruled that forcing ECT on a patient without their consent can violate human rights, especially if the patient lacks insight into their condition. In practice, if a patient with schizophrenia is deemed capable of making informed choices, their refusal of ECT must be honored. If they are found incapable, clinicians might seek legal permission to proceed with ECT, especially if it is seen as essential for treating severe symptoms or preventing deterioration. Patient advocates and legal representatives often help protect the rights of patients during these situations. In summary, patients with schizophrenia can refuse ECT if they have the capacity to consent. This capacity involves understanding the treatment and its consequences, which can be affected by the illness. When capacity is lacking, legal frameworks may allow ECT without consent to ensure necessary care. Patients can appeal involuntary treatment decisions, and there are safeguards to balance treatment needs with human rights. The decision to administer ECT without consent is complex and involves clinical, ethical, and legal considerations specific to each case.